This is a series of movements, very slow, very small movements that are designed to help us relax and lengthen and open the pelvic floor muscles. So you're going to be on your hands and knees, and I would recommend, I'm doing this on a treatment table, but I would recommend doing this on the floor so your surface that you're on is pretty firm. Okay, so finding this position, and you want to feel like you have weight in your arms, and ideally you're really letting all the muscles that are around the leg, in front of the leg, the hamstrings, quads, glutes, everything is just really as loose as you can consciously make it. Okay, so from this position, you're just going to start with rocking, and it's really small, it's really slow. But you're trying to connect with the fact that you are trying to open and let go of any tension that your body has in the legs and the pelvic region. And as you're rocking, you can feel free to inhale and exhale. It doesn't have to be very specific in terms of the timing. But I would advise, as you inhale, let your belly fill. Let the muscles relax in your belly. Don't feel like you have to hold them in. A lot of times as women, we tend to hold our abdominals inward for a variety of reasons. You just want to feel like you are opening up. Bringing air all the way down to the pelvic floor muscles, which are right around the vaginal opening, which most folks know where that is. You can also start to take this on little diagonals. So instead of going straight back, I can't express how slow you want this movement to be. I know it might be painful for some of you in terms, not really painful, but just the speed. It's like you're used to moving fast. But this is your time to build some awareness with what things feel like in your body as you're moving. A feeling without even having to look, you're feeling in terms of what messages are getting sent to your brain. So for instance, I'm moving right now and I can feel movement. Things are happening, things are lengthening, things are moving in a certain area. So like as I go this way, I have sensations of things in this region. Not bad, it's just, oh yeah, I'm moving, my body's moving. That's your body's inner sensor system, if you will, like little proprioceptors. These are what send messages to our brain. So you want to move nice and slow and try to really build that awareness. Okay, one more time each side. Feel free to exhale, let that air out. Okay, then you're going to go wide knee, and you can go down on your forearms if you can. Now, you don't want to push far into this motion to the point where you feel, if you're someone that has hip flexor pain or discomfort, that you feel pinchy. So be mindful. I'm nice and supported. And again, I'm thinking of letting my sits bones spread away from each other. I'm letting my tailbone and my pubic bone move away from each other. If you can imagine that image. Okay, so our pelvic floor is like a diamond. And when we're trying to lengthen or stretch it, we're trying to make the diamond bigger. Okay, so sometimes using images of the sits bones, images of the pubic bone, tailbone moving all away from each other, you can create this relaxation response as well. Okay, so again, keep this slow, keep it in a range that you don't feel like your hip flexors are unhappy with you. And breathe. Inhale, exhale, very passively letting the air out. Okay. Next, you can come back up to hands and knees here. And you can start to do little little circles with your pelvis. So again, I don't want you to feel like you're using or activating any muscles to make this motion happen. You're just thinking truly, I know it sounds a little weird, but you're just like, I'm just letting my bones move. I could do this and be like gripping and feeling my core muscles and tight pelvic floors and glutes. Or I could do this and I'm literally, it's so subtle of a weight shift and so slow that I don't feel any muscles really working, with the exception of maybe a tiny bit of muscle activation. Like my hands are in the ground. So I do feel my deep core is on, but I truly don't feel like much is happening. And then you can reverse it. So you're imagining you have a tail and you're just doing circles with your pelvis, with your tail, nice and slow all around. So it's like you rock back and stick your tush out a little bit as it circles around to my right. And then as you come forward, it kind of tucks under a little bit, but again, not so drastic that you feel like muscles are really activating a ton to make this happen. And then you can reverse the circle and you're going the other way. So I would suggest doing about a minute, 30 seconds to a minute each side. Now, anytime you're on hands and knees, if we're trying to create pelvic relaxation, I do feel like my arms start to get tired because I have weight in my arms and I'm really trying to, like I said before, let everything go in the lower body. So feel free to take breaks. And then the last thing you can just do is go to a wide knee child's pose. So I apologize if this gets louder. I'm just dropping my head closer to the microphone. But if you have glasses like me, I typically take them off. Rest your forehead down. Let your body sink back. If you do have hip flexor pain with this or discomfort, putting a rolled up pillow here, so taking a pillow, folding it in half, and letting your body curve over the pillow could be helpful. Or even getting a pillow really getting a pillow behind here and sitting back so it's supporting you a little bit. But essentially, you want to feel like you use as many props as you'd like to really let your body rest down into this position. And again, breathe for about a minute. As you inhale, you're imagining those sits bones opening. You're imagining any level of tension around the vaginal opening just dissipating and melting away. And as you exhale, you're just letting your bones, my head, my arms, my elbows, my knees, drop and get heavy into the table.